Okay, we're doing heart disease part 2, John Mcdougall, the doctor who fought for you, by me, P. Rogers. Okay, starting out with coronary artery stents. Coronary artery stents are like the big drama procedure for cardiologists. You know, I was an imaging guided surgeon back in the 1990s, and stents were a big deal. First of all, the guy who invented coronary artery angioplasty, I think his name's like Andreas Grunzig, you know, German guy. He's like this big world famous celebrity hero. And then Julio Palmaz, inventor of the Palmaz stent, one of the first stents used. Big celebrity, multimillionaire, it's a big glamorous thing. And then somebody like Esselstyn, he will not be allowed in the textbook. Esselstyn has like 99.4% no recurrent coronary artery events. Incredible, wonderful results. And his patients often, improve, resolve their hypertension and other problems when they go on his low-fat vegan diet. He'll never be allowed in the books. Okay, and then listen to this nonsense. Even with the best, fanciest version of stents, where they've got the drug-eluting stents, the DES, and there's a 0% reduction in dying, okay? It doesn't change whether or not they die or not, because it doesn't really treat the lesions that are likely to have plaque rupture and occlude the coronary. It can cause a reduction in coronary artery angina symptoms, but it doesn't do that much, okay? So they don't like to talk about that, and you won't see too many cardiologists who want to stent in their own arteries, A lot of cardiologists, they're pretty with it about health. They exercise, they eat a plant-based diet, but, patients are a bunch of chumps. A lot of money. We place a stent, you bill for about $30,000. You do an open heart surgery, coronary artery bypass graft, CABG, that bill's for $150,000. That's a lot of money. You teach them a vegan diet, what is that, $1,000? It's nothing compared to that. That's why if you run a hospital, you want patients going for stents, going for CABG. Okay, CABG also has no improvement in survival. These are Dr. Mcdougall's words. You can see them in his newsletters and his videos. Here it is: do low carb diets and increase the risk of heart disease. Another study came out, a 4 study, and it showed the same thing, that low-fat diet can stop chest pain and help arteries to heal. Recent data shows that statins are not that useful for reducing the risk of dying from heart disease. They are ineffective. So there you go. All the conventional treatments, they stink. Stenting, it doesn't work. CABG, it doesn't work for coronary artery disease. And statins, they don't work too well at all. Low-fat vegan is about 100% cure rate if the patient follows the diet. Esselstyn said the one patient who had that complication didn't follow the diet. He just put it in there to sort of like be nice, make his results look more real. So, other cardiologists have gotten the same results. That's the only thing that'll reverse it. That's worth remembering. The only diet to reverse coronary artery disease is low-fat vegan diet. So why wouldn't you want to do that? And it makes everything else better too. Why wouldn't you want to do that? Okay, differential diagnosis for chest pain could be esophagitis, pain on swallowing, something in the esophagus, inflammation, costochondritis, the ribs, pericarditis, the outer layer of the heart, myocarditis, the muscle in the heart, Boerhaave's esophageal rupture. Now that's a total zebra. I've seen one Boerhaave's rupture in the last 20 years. I've seen one case. I saw one case before that, the 10 years. So I've seen one case every 15 years. That's how rare Boerhaave's esophageal rupture is. Thoracic aorta dissection. I have seen a lot of those. I mean, it's still rare, but I do see those. I see a couple of those every year. I see about 4 every year. Pulmonary embolism, that's real common. I see tons of those. I see like at least 1 a month. Pneumonia with pleuritis. Yeah, lots of pneumonias. Not that often it has pleuritis, but it can. Okay, angina pectoris, chest pain related to ischemia of the heart, lack of blood flow in the heart due to atherosclerosis. Duration of minutes, rest usually follows, and it relieves. Annually, about 4% of people with cardiac angina will die. Okay, heart attack, myocardial infarction, occlusion of a coronary causes the heart muscle supplied by it to die. Myocardial infarction is associated with chest pain, often feels like a pressure, radiates to the jaw of the left arm. That's sort of the classic description. It feels like an elephant sitting on my chest. About 12% of MIs do not have very little, if any, chest pain. Okay. In the Western world, the older the patient, the more likely they will have significant coronary artery blockages on a cardiac cath angiogram. So a 30-year-old, about 25%. 40-year-old has about 50% of them will have what is considered a significant blockage. The bottom line is if you eat the SAD diet, you're inevitably screwed. And so what I would say is, a lot of people say, oh, should I go for a cardiac cath? Let me tell you something. It's a sign that you got weak thinking about health if you think all these screening studies are a good thing. What are you going to do? Let's say you got narrowing. What are they going to do? They're going to tell you put a stent in or go for CABG. Both of those treatments don't really work. So why wouldn't you just go low-fat vegan and it cures it? Why wouldn't you do that? That's a smart thing. Because I know doctors that went and had cardiac CT of the chest, cardiac CT for calcium or cardiac CTA, where you inject IV contrast to opacify the coronary artery vessels. So you give yourself all that radiation for what? You know you got it. If you ate the SAD diet, you have coronary artery disease. It's guaranteed. So why wouldn't you just eat the low-fat vegan diet and prevent it from ever becoming symptomatic? That's a smart thing to do. That's what I do. I wouldn't radiate myself for no reason. I already know I had some because I ate this. I never ate a full-blown SAD diet, but I ate almost like what you might call a Mediterranean diet when I was younger, not knowing any better. Then the healthiest diet, again, it's a low-fat, low-sodium, starch-based, whole food, 100% vegan, 100% organic with no oils. There it is. Okay, that's it for part 2. Hope that was helpful.